Hi everybody, my name is Nick Johnson. I am the Vice President of Surgical Services here at Riverside Community Hospital.
Hi, I'm Dr. Nuthan Winston. I'm the Chief of Anesthesiology at RCH, and we are here today to share with you our preparations for starting elective surgeries on Monday, May 4th.
That's right. As we return to doing elective surgeries here at Riverside Community Hospital, we want to create some processes that address the concerns and the safety of our providers, our healthcare workers, and our patients.
So let's take you on a walk to share with you the process for what to expect when you come in for your elective surgery.
So on day of surgery, when patients come to RCH, all of our surgical patients will come through our G-Tower lobby right behind me. What we're going to do is take you through the process that all of our patients, visitors, physicians, and healthcare workers go through to be screened so we know they're healthy as they come through our building. Come with me. So as we move into our screening station, first thing we're going to ask all of our visitors and everybody coming through our doors to do is to wash and sanitize their hands. If they're not already donning a mask, each one of our patients, employees, providers will be given a mask to wear. So once our patients and visitors go through the screening process, they enter our G-Tower lobby. This is our newest tower here at Riverside Community Hospital, and surgery is just up on the second floor. So come on with us. So now we're up on our second floor. Here we have our surgery waiting area where patients and visitors wait for their time to go back to pre-op. We also have a registration window in here where patients will finish their registration and be ready to go back to pre-op.
Our top priority is protecting our patients, visitors, and our healthcare workers. So we are observing social distancing as well as universal masking in all these areas.
So as you can see here in our patient waiting area and visitor waiting area in surgery, we've created social distancing by eliminating some of the chairs that we have available for seating. So once our patients are done in our waiting area and our visitors, we'll be moving into our pre-op area immediately before going into the OR.
What separates us from other hospitals is the fact that we have these private rooms where our patients come in order to be prepared for surgery. In all these rooms, several times a day, these surfaces, the computers, everything in the room is cleaned and disinfected.
So here at Riverside Community Hospital, with safety being our #1 priority for our elective surgery patients, we've created an environment here in pre-op that is completely separate from the other patients in the population of the hospital. We've also created separate entrances.
Everything in these rooms is being isolated and deep cleaned every day in order to minimize contact risk as is being done throughout the hospital.
So once our patients are done in pre-op, we're going to move into the OR. So here we are in our brand new OR space here at Riverside Community Hospital. Very excited to bring this to our providers and our patients as I think it provides us certainly an advantage of how well we can take care of our patient population. So why don't you come on in with us. So as you can see, this is one of our 3 new ORs here at Riverside Community. Again, really excited about the opportunity to be able to provide this platform for our patients.
At Riverside Community Hospital, our surgeons and our operating rooms are well equipped to take good care of different kinds of procedures. We do a lot of trauma surgery here, general surgery, cardiac surgery, neurosurgery, and spine surgery, as well as special procedures for stroke. At Riverside Community Hospital, we are well equipped to take on the state-of-the-art minimally invasive and robotic surgeries.
So here in the OR, patients and providers can have the confidence that the environment is very safe for them. We accomplish this in a number of ways, not only in between cases, where the environment is disinfected and sterilized, but also at the end of the day through terminal cleaning of every one of our OR spaces. As part of that, some of you may have heard of UV light and its efficacy on viruses, including COVID. Here at Riverside Community, we have the TrueD system. Every night, this unit is rolled into each and every one of our ORs, spends the appropriate period of time in there, and has a very high kill rate for all viruses. We definitely have a little bit of a differentiator there compared to other hospitals. Not every hospital has this. And I think given the current environment, certainly separates us from other hospitals. So here at Riverside Community Hospital and Surgery, we recognize that creating a safe environment for our patients and our providers starts well before day of surgery. With that in mind, we made the decision to move our pre-admission testing clinic out of the main hospital and across the street to our De Anza surgery department. Now, I know if I was a patient, I would be rather apprehensive about coming to the main hospital for not only my day of surgery, but also for a pre-admission testing clinic day. With all of that in mind, this decision not only allows us to treat the patient in an outpatient clinic setting away from the main hospital, but also provides us the unique opportunity to test every one of our elective surgery patients for COVID. Now, with all of that knowledge, we can make the best decision about moving forward with the surgery based on what we find out from the testing. So here at our relocated pre-admission testing clinic, we're practicing the same standards that we practice in the main hospital around screening, universal masking, and social distancing. You can see here in our lobby, we've created an environment where we've prevented the close contact of patients, all in a way of preventing the transmission of COVID between visitors or patients or employees. Now, one of the big deciding factors also in moving our pre-admission testing clinic to De Anza is that this is a completely COVID-free environment. We have not been performing surgeries here. The De Anza Surgery Center has been closed since the beginning of making the decision to delay elective procedures. It's a very safe environment. Again, creating a safe environment starts well before day of surgery. So as we prepare to resume doing elective procedures here at Riverside Community Hospital, we want to do it in the safest way we possibly can. And that includes testing all of our patients for COVID within 72 hours. Now, whether that's through a face-to-face PAT appointment or through our new drive-through testing center here at De Anza, we're able to turn results around for our COVID testing, again, within that first 72 hours of day of surgery. That way, come day of surgery, we can make a decision on whether or not we're going to proceed with the surgery and treat the patient in the safest way we know how, keeping our providers, our healthcare workers, and the patient safe.
We are looking forward to taking care of you at Riverside Community Hospital, and we want to reassure you that you will receive the highest level of care here.
As part of that commitment to caring like family, Riverside Community Hospital was recently awarded the Leapfrog Grade A National Safety Recognition. If you have any questions regarding elective surgery or surgery in general at Riverside Community Hospital, please find us on our website or look us up on Facebook. We look forward to taking care of you and our patients.